Many people contact an orthopedic surgeon when they're scheduling a planned joint replacement. But what do you do when there's an emergency from a fall, a crash, sports, or a workplace incident? Well, that's where the orthopedic trauma surgeon comes into play, and Trinity Health wants you to know they've got you covered. Dr. Andrew Fras, he's one of those orthopedic surgeons. He's kind of top dog. He's joined us in studio to share more. Good morning, doctor. Thank you.
Good morning. How are you?
I'm well. Well, my shoulder's a little. Oh wait, not that kind of. How are you? You are a doctor. When people ask, you know, when they get that question from a doctor,
we get a lot of those. Yes,
my shoulder's acting up a little bit, but that's not what we're talking about here. We're talking about a crash, a bike fall, something happened. That's when the trauma surgeon is needed.
That is correct. So yes, we see a lot of fractures, and it can be just a simple fracture from a fall that maybe you can come in and see our urgent care or emergency care facility and maybe do that outpatient. But also you may, a lot of our patients we find from car crashes that are brought in through EMS, through the emergency department, and may have multiple fractures and can be pretty sick. So we take care of it all from beginning to end. And yeah.
Those are the common injuries that you're treated. I'm assuming with the elderly population, with the baby boomers getting older, you probably see an uptick in some of the things that you're dealing with?
See a lot of hip fractures. Hip fractures, in fact, I was just out golfing the other day, and one of my buddies said, what do you see most of? And it's hip fractures in our elderly patients. So got a variety of surgical treatments for those. Those are usually a surgical, we call urgency, meaning that you come into the hospital and you get that fixed and you start rehab right away. And we have a lot of treatment options nowadays that we're trying to get you fixed within 24 hours and get that person up and walking because we know that their outcomes are going to be better.
Let's talk a little bit about that treatment approach. You know, when you mentioned this, I'm thinking of that old classic television commercial where the elderly woman falls down and says, I've fallen and I can't get up,
yes,
right?
Sir.
But those are the types of situations where you're like, hey, it's an emergent situation for you to help that get and take care of. So how is that treated? You say there's a meeting first.
Yes, so usually our folks will come in through EMS in that type of a situation.
Sure.
And they will be evaluated by our emergency department, and then they'll have been diagnosed with a fracture, and our service will get consulted. And then because that's a surgical urgency, meaning they can't walk or mobilize very well, we have a goal of fixing those patients within 24 hours. That's always the goal, and getting them up and getting them moving with our physical therapy team right away, because we know from research, comprehensive research, that shows those patients get better and are more likely to return to baseline. Now, not everyone does, of course, but more likely to return to baseline if we can do that for them.
Okay, so the catalyst here is the quick recovery time to get them back to that baseline.
Correct.
So 24 hours. I mean, somebody who's going through this probably thinks there's no way that within a day they'd be able to move again.
It's pretty surprising when I come into the preoperative area and say, hey, we're going to get this fixed up, and we're going to be able to have you walking later on today. And they look at me a little strange, but, and that's not for everybody. Some people come in different states of health or different states of abilities, but our goal is to get them back to at least their baseline and add quality to their life, especially in our elderly patient population.
Absolutely. And when should someone seek care? Obviously, if there's an emergency situation, if there's a fall, that's easy to know. But
sure.
When do you know when it's something that you're scheduling for a knee joint replacement or something that maybe you need to get to quicker?
In the case of injuries, if someone can't, like in the lower extremity, if they can't bear weight, or if they can't use the extremity normally, if there's a deformity, obviously you're going to want to seek treatment at urgent care, one of our urgent cares, or the emergency care facility. And it's pretty obviously to get a quick diagnosis from then on,
Absolutely. Hey, listen, it's not just about scheduling that next replacement. When something happens, if something happens, you are covered by Trinity Health. And if you need more information, maybe you're going through that today. This could be perfect timing, right?
Yes.
Trinity.
You do have a choice, right? You have a choice. We have a lot of wonderful healthcare providers in this town, but you do have a choice. And so I think that Trinity Health in particular has a very compassionate team. I have a very compassionate team in the office and the OR staff, and I just kind of want to give a shout out to them too, because I think that's where we set the line a little bit
That's
better.
where you excel,
so
right? You've got the
absolutely.
knowledge, you've got the expertise, but you also have that amazing staff and that personal care.
Absolutely.
But trinityhealthmi.org/ortho if you want to learn more. Doctor, thank you so much for the time this morning.
Thanks, sir.
Appreciate it. We'll be right back.